We love it. It's awesome.
I've come from a rural community and now I'm back in one now, so it's been really special for me.
It's been amazing. Yeah, I've been really lucky to train here this year. Been amongst a great bunch of doctors and nurses and staff in general that are really supportive.
We rave to each other every day about all the awesome experiences we get to have and the amazing doctors here. It's truly a privilege.
I'm Professor Tim Wilkinson. I'm the Acting Dean of the Otago Medical School. Here at Otago, we're pioneers in rural health. We've been doing it for many, many years. We've had a long-standing commitment. We've put our money where our mouth is by training students, by training doctors and supporting practicing doctors over decades. In 2023, we had medical students in 57 different places in New Zealand, and 48 of those were rural settings.
I'm Gary Nixon, Professor of Rural Health at the University of Otago, as well as a rural hospital medicine specialist here at Dunstan Hospital in Clyde. Otago's geographic footprint means that we are very much a leader in the delivery of rural health education in New Zealand.
The problem in the past has been that rural people have been underrepresented in our doctors, and we want to fix that. And one way of fixing that is making sure that we encourage people with a rural background to apply and enter medical school. We know that if students learn in rural communities, they're much more likely to come back and practice there. They feel supported, they feel a commitment to that region. For me, it's a win-win.
Right, Mary, we're just going to give you some medication, might help you breathe better, okay?
I'm Janine Lander. I'm Clinical Director of the Rural Medical Immersion Program at Otago University and Rural Hospital Doctor at Ashburton Hospital. The Rural Medical Immersion Program is a one-year program for fifth-year medical students at Otago University. They take a year out from their traditional academic program to spend a year living and learning in rural communities. The Rural Medical Immersion Program started in 2007 in Queenstown and the West Coast with 6 students. It grew from there quite quickly to include Tararua, Wairarapa, Marlborough and Clutha. And then in 2020, Ashburton came on board. In 2023, we were granted more government funding to expand further. So now we have new sites in Wairoa this year and Alexandra.
Is just have a listen to your heart. Kia ora, ko Tanira Kingi tōku ingoa. Hiuria hau no Ngāti Whakauē, Ngāti Toa Rangatira, Ngāti Tūwhare Toa Huki. My name's Tanira. I'm a fifth-year medical student here doing the Rural Medical Immersion Program in Te Wairoa. We get a lot more focus with the doctors. It's all one-on-one. We're able to do skills that we wouldn't really otherwise get to do in a large hospital. It's just so beautiful being able to connect and establish some whakawhanaungatanga with our community.
I feel better, so I'm ready to go home.
Ko Ngāti Kahungunu ki te Wairoa te iwi. No kōnei o, I te puaki o ki te Waipounamu. Ko Mackenzie Wilson aho. My name's Mackenzie. I'm doing my 5th year RMIP here in Wairoa this year. We've had excellent learning opportunities and I would say we've got such a good basis from this year, especially going into our exams at the end of the year. I think it's actually been an advantage for us.
Charge. Kia ora, I'm Dr Liffey Rimmer. I'm a GP and rural hospital doctor and I'm the coordinator of the RMIP program in Wairoa. It's been great. The students have been a wonderful 3 young women. They have brought a lot of enthusiasm and energy. We've definitely seen their confidence increase. So I think it's made them much more resilient, self-reliant. We have the highest per capita Māori population in Aotearoa, so that's around about 60%.
Since day dot, I think we've noticed the impact that the natural disasters that have been going on in the country have affected the whānau here. And it's evident in their health and well-being, in the land, the whenua here.
They come away with a wider appreciation of that sort of socio-economic impact on health.
A lot of the health services, they are under a lot of pressure and there can be a right time and there can be a wrong time to expand into those communities. I think, given our connections means that we're well positioned to be able to do that in a way that it achieves the workforce gains that we want to achieve, but without putting undue pressure on those often fragile health services. Otago can be very proud with how it has addressed social accountability for those groups and how it has engaged with those communities.
They become really involved in their local community. It's not just the healthcare learning, they join sports teams, become members of clubs. Within the healthcare environment, they become strong advocates for their patients.
They've been playing netball, paddleball, they've been competing for Wairoa in the CrossFit Championships. There can't be many whānau in Wairoa that haven't met at least one of our students yet.
Are you managing to get up and move around at all?
We know from New Zealand data coming through that the graduates of RMIP are nearly 6 times as likely to return to rural practice after graduation.
Kia ora, ko Matt Tūmohi tōku ingoa, he uri ahau no Waikato Tainui. Kia ora, I'm Matt Tūmohi and I'm a 5th year RMIP student at Dunstan Hospital. Yes, I grew up rurally in Otago, South Otago region, was brought up on a farm. When I left high school, I wasn't too sure what I was going to do, but at that time I was able to shear sheep, so carried on and did that as a job, and then progressed on to coming back into university. But I had no idea about studying medicine. That wasn't something that was really on my radar. I know coming into the program, I was always excited about being able to get this sort of exposure, but I think this year has kind of consolidated a lot of my previous thoughts about working in rural communities and going back to serve the people of the communities that I come from.
Has she been having any fevers associated with that at all? I'm Stephen Potter. I'm a 5th year Otago medical student placed here in Ashburton through RMIP. I originally came from Invercargill, but what RMIP has meant for me is it's given me exposure to this smaller community, which actually reminds me a bit of home. I originally was like, I'm never going back to those small communities again, but actually being back here and seeing the smaller communities has made me kind of consider quite strongly, maybe this is actually where the better lifestyle is, maybe this is the type of medicine that I want to practice.
If you're the sort of person that likes being out there, trying new things, community-minded, really likes learning from patients, getting hands-on experiences, then RMIP is absolutely the program for you.
We also have 2 additional programs, one in Tairāwhiti and one on the West Coast, where we focus on interprofessional learning.
And it has the original dentist example that was proposed.
I'm Georgie Beard, the program leader for the Otago University IPE program. We have a group of final year students that come and live and do their study in Tairāwhiti for a 5-week program. We have medical students, dental students, oral health, physiotherapy, pharmacy, and then we also outsource from other providers. So we also have midwifery, nursing, podiatry. They live together in hospital flats. They work together on projects. They have their placements in their own specialty area, and then they also go and visit their student colleagues in their own placements as well.
Kia ora, my name's Reef Edwards. I'm a 6th year med student through Otago Uni here up in Gisborne doing the IPE project. I suppose in medicine it's easy to get isolated in your own profession, but being able to have that opportunity to talk and discuss different cases with other professions and other students in the different professions is really valuable to me.
Health wants to get out of it.
It's been interesting just being able to meet with Māori patients, and you can connect with them on that different kind of level, like I found that patients will often tell me things that they have kind of neglected to say to the consultant. I don't know if it's because I'm Māori as well and just can have a yarn a little bit more openly, but I suppose that's kind of highlighted the need for more Māori health professionals in the area.
It can be a bit of a misconception that once you exit medical school that your training's finished. In many respects, it's really only beginning because that's when you start your vocational training in your relevant specialty. So in terms of generating a future rural workforce, probably this is the area where Otago, even by Australasian standards, has really been a leader.
How are you feeling today? I'm Dr. Rachel Linsky. I'm a rural hospital specialist working at Dunstan Hospital in Central Otago. I was one of the very first rural medical immersion students. In 2007, I was based in Greymouth Hospital for the 5th year of my medical training. And I came down to Central Otago as a house officer and then again as a registrar, and that was the time that my love for rural medicine and rural towns really grew, and I knew that it was the path that I wanted to take. Well, I think rural hospital medicine is a really exciting pathway. You have to know a little bit about everything. You get to work with a small, cohesive team, just managing all sorts of things that come in the door. It's a really nice way to be able to look after your own community as well.
I couldn't get a line. She's got burns in both upper arms. I think we might have to go IO.
As part of our partnership with the Ashburton community, we have a simulation centre in Ashburton.
Cool. Line's flashing well.
They bring together doctors and nurses from the Rural Health Service and give them an opportunity to train in that simulation environment, particularly to handle trauma and medical emergencies.
90 seconds, she will not be breathing.
Our research program's now a multi-million-dollar program in terms of bringing in external research funding, and it's a very broad program as well. So a lot of recent work is concentrated on access to health services for people living in rural areas.
Together we will continue to innovate and educate. I'm really pleased that here at the University of Otago Medical School we've just launched the Centre for Rural Health. It's a culmination of our commitment to rural health over many, many years. We've been doing training of medical students, postgraduate doctors and supporting practicing doctors in rural health, but this is an opportunity for us to bring it all together under one umbrella.
One of the biggest challenges we face is rural high school kids actually thinking about medicine as a possibility for them. I mean, I've practiced here my entire career, pretty close to where I grew up. I know that these are the best medical careers, and it would be really good if there was just a few more rural kids who saw that as an option and an opportunity for them. We certainly geared up to make that happen if they make that choice, and certainly geared up to try and support them every step of the way.
I'd say don't be afraid to put yourself out there and to be uncomfortable. I think a lot of students steer away from rural placements because you're isolated. You might not be with people that you know very well. I feel this year in my entire medical journey has been the most transformative. I've formed such close friendships. I've had the opportunity to be immersed in a Māori community.
We've pioneered rural medical education in New Zealand. We've got the links, we've got the experience, we've got the breadth, and we're really keen to do more.